Hello everyone, and welcome to this audio podcast. This audio podcast, as part of the ShiZMode Chapter, this audio podcast is part of an analysis and exposing and lobostics. This audio podcast, as part of the shitstorm Motley and the Jump Off. This audio podcast is part of a segment of V2 and a Storm Lobostics production. So continuing on in around looking at and following a sort of following sort of the previous audio podcast, looking at smarter practice. This audio podcast looks at implications to practice, implications or aspects pertaining to practice. So one of the things is that digital tech and data science techniques can be utilized to improve identification of individuals or residents in nursing and care home environments who may be susceptible or at risk for in around a particular treatment modalities or treatment categories in as where nephrotoxicity is concerned or are concerned, and thus reduced delays in review, monitoring and referral to specialist services. Therefore, is and are tend to be tend to be important or necessary. So at the same time, the use of nephrotoxic medicines may be appropriate in some individuals. Similarly, individuals with sort of where pathophysiology, where there can be pathophysiology in amongst nursing and care home environs, where the where pathophysiology is or can be affected from medicines. This is where dose treatment or dose requirements would additionally be where drug doses or treatment modalities in around where nephrotoxicity is or can be is additionally where they would need where certain treatments, for example, prescribed treatments, for example, would need dose adjustment. In these cases, there should also be a sort of consideration as to whether whether if and whether if and whether the residents in nursing and care home environs would advantage from screening or early screening methodology, such as for example cystatin C, which is, although not routinely utilized or as comparison to predecessor renal or sort of screening assays such as creatinine or creatinine clearance. It is where renal screening methodologies can ultimately improve the accuracy for individuals where using creatinine or using creatinine clearance as a biomarker on its own maybe or could be problematic. It could be problematic. For example, in those who have low mass, since creatinine clearance or creatinine clearance is a biomarker that relies on in aspects of screening as part of muscle a muscle or sort of muscle breakdown, as sort of wherein, for example, creatinine in context of pathophysiology, just as a reminder, it is a byproduct of muscle breakdown. And so, in as where there are those in amongst nursing and care home environs, for example, then creatinine clearance, although not discussed not evidenced in amongst this particular collaborative works from 2019, it is where one of the aspects is to was to highlight that cystatin C, for example, might would be more advantageous in nursing and care home environs, since the population since the population or populace in amongst in amongst those environs by default to an extent would have decreased muscle mass, and thus using creatinine clearance alone as an assay in such populace or populations would potentially give false positive analysis in context of laboratory investigations. And so in as part of this, it is where cystatin C could improve the accuracy in such individuals. That draws this audio podcast to a close. This audio podcast as part of the Shitstorm chapter. This audio podcast as part of the Shitstorm and Motley. This audio podcast as part of the Jump Off and segment of V2. This audio podcast as part of the Analysis and Expose and Lobostics. And this audio podcast as part of a Storm Lobostics production.